everyone. I know that we have a very packed agenda, and as most of you in this room know, we decided to start our meetings at 8:30 because 8 o'clock is just too early for some, and that's okay. But we are under a pretty intense block to get our work done. More bills this year than any other short session, so we've got to get a lot done. But today, if it's okay with the concurrence of both sides I've talked to, we're going to hear the subcommittee reports, and then we're going to go to a sign-up sheet, and we are hopefully going to get all of our business done today. There are a couple of items here that somebody has some thoughts and concerns and passions about. We're going to handle it hopefully like we have in the last couple of years. I'm going to put a 2-minute clock on those. I don't think there's a lot of changing of minds that will happen today, and if a number of things that's not acceptable, just let me know. We'll work our way through it. But we want to kind of get through our agenda and hopefully cover everything that we're expected to do today. Senator McClellan asked me on the way in if we would consider striking Senate Bill 1519 related to vaccines. There's a motion second to strike Senate Bill 1519. All those in favor say aye. Aye. Those no. That bill is stricken. And she also asked that Senate Bill 1476 go by for the day without objection, and that bill will go by for the day. So this morning we're going to start with our subcommittee reports, and I'm going to call on Senator Carrico with the subcommittee for public education to begin.
Thank you, Mr. Chairman. We'll start with Senate Bill 828. This is a recommendation or a presentation by Senator Wexton. There was line amendments that were adopted, and I so move those.
There's a motion second that the line amendments be agreed to. All those in favor say aye. Aye. Those no, and the line amendments are agreed to. Senator Carrico.
Okay, this bill with the amendments was presented to us to basically require the family life education, child sexual abuse, we call it, through grades K through 9. That was the amendment that was adopted. Because this bill actually requires this to be taught, they already have the authority to teach, but this makes it a requirement. The committee recommended, there was a recommendation to report, but the amendment or the recommendation failed on a 2-3 vote, and I would move that we PBI the bill.
Second. There's a motion second to submit this bill be PBI. All those in favor say aye. Aye. Opposed no?
No.
No. The clerk call the roll.
Senator Sassel? Senator Lucas?
No.
Senator Howell?
No.
Senator Locke?
No.
Senator Barker?
No.
Senator Black?
Yes.
Senator Carrico?
Aye.
Senator Peterson?
No.
Senator Cosgrove?
Aye.
Senator Lewis?
No.
Senator Donovan?
Aye.
Senator Chase?
Aye.
Senator Sugarland?
Yes.
Senator Peake?
Yes.
Senator Newman? 8 yeas, 6 nays.
Okay. That bill fails to report 86. Senator Carrico.
While we're still on that subject, let's take up Senate Bill 1235, which was a similar bill dealing with family life education presented by Senator Evans, requiring the school boards to implement the same regarding family life education. It was recommended to pass by death on a 3-2 vote, and I so moved.
Okay. Motion is second that the bill be PBI. All those, we'll start call the roll.
Senator Sassel? Senator Lucas?
No.
Senator Howell?
No.
Senator Locke?
No.
Senator Barker?
No.
Senator Black?
Yes.
Senator Carrico?
Yes.
Senator Peterson?
No.
Senator Cosgrove?
Yes.
Senator Lewis?
No.
Senator Donovan?
Yes.
Senator Chase?
Yes.
Senator Sugarland?
Yes.
Senator Peake?
Yes.
Senator Newman?
Yes.
8 yeas, 6 nays.
That's report. Senator Carrico.
We had 2 bills, or actually 3 bills dealing with 1215, which is Senator Stewart's bill, for public schools possession of glucagon. There was a lot of conversation about this bill, about the shelf life of glucagon, how it is to be prescribed, and the requirements of the school to administer it. It was the committee's recommendation, because of all the complications of having to do that, to pass by the bill definitely on a 5-0 vote, and I submit.
There's a motion second, so we can keep the item. Now, just so I understand, did we roll a bill into that?
That is insulin pumps. This is not. This is
Very good. There's a motion second that the bill be keep the item. That was unanimous. All those in favor say aye. Opposed, no. And the bill will keep the item. Senator Carrigan.
Okay, the next was Senator Stewart's bill 1214. The Senator McPike had a similar bill, which we rolled into 1214, and there should be a substitute for that bill. That
Not, will roll in, the language is the same Senator decided.
All right. Okay, so now we have one bill, Senate Bill 1214, which gives the school health services the ability to insert the insulin insertion for the insulin pumps. Senator Donovan actually was very helpful in giving us a brief overview of how that actually works. And it requires the school employees who are required to have training to administer this insulin glucagon, and also have training for the use of the insertion of this needle. And it was recommended to report the bill on 5-0 vote.
Mr. Chairman, I wanted to, and I apologize to you, I wanted to just have a live temporarily. That's
Okay.
I think there's some opportunity for.
I would also recommend if you want to have a discussion on it, Senator Donovan is very familiar with how all this works, so I would defer to her.
Okay, turn it over to her.
She was very convincing, let's just put it that way.
All right, that was by temporarily.
The last was the discipline bills, and they're not on here because I think that those bills need a little more work if they want to come out of the committee. So
We'll just,
I'll hear those this afternoon.
so there are some ones that are related to discipline. We want to make sure we get a good discipline bill out of this, but there are more information that's coming. So without objection, I've asked those to go back into the subcommittee and work our way through a good compromise bill that we hopefully can all support.
That concludes my.
Jericho, thank you for your help. Next up is Senator Sasslaw. You want to go now, or if you'd like to go just a few minutes? Okay, so what we'll do is we will go then to the Committee on Health, and Senator Cosgrove has been very helpful there. Senator Cosgrove?
Thank you, Mr. Chairman. There's 3 bills we need to take action on today. At the request of Lady Senator Watt, she asked that Senate Bill 885 be stricken.
All right, there's a motion, and without objection, the bill will be stricken.
Thank you, Mr. Chairman. This bill is Senate Bill 1028, Senator Henry's bill. Senator Henry worked hand in hand with clerks, courts, Supreme Court, I was a no on that. And just very quickly, the policy that's been followed has been very brutal to the families, and that is why I'm in favor of Senator DeStef's bill.
Thank you, Senator Lash. I know that is important to you, so hopefully we can deal with that through the letter process. So there's a motion and a second that the bill be TPI, and Chairman send a letter related to Senator Black's concern.
Mr. Chair.
Senator Parker.
Just to elaborate a little bit on that, under the federal rule that's been adopted, we basically have until St. Patrick's Day of 2019 to resolve this issue, and that part is on the TBI for now. There will be opportunities to work and get clarification at the federal level on how things would work, and still be able to address it next year without the things of March of 2019.
Perfect. Thank you for that explanation. Therefore, the bill, motion is second, the bill be TPI, get a letter. All those in favor say aye. Aye. Opposed, no.
No.
The bill is TPI. That completes your report.
Yes, sir.
Okay, next up, we go to higher education, and Senator Sasswell had a number of bills. Senator Sasswell.
The first bill was Senator 907, and that was Senator Servell's bill. The motion to report that, what it does, it deals with the governing boards of public institutions, essentially saying that the chair and the vice chair and the residents of the Commonwealth fail to report by recommending the report of the 23-1. And subsequent to that, the universities have talked to us about the problem with that, talked with Chairman Newman. So there is a substitute.
There's a motion second that the substitute be agreed to. All those in favor say aye. Those no, the substitute is agreed to. We did have conversations, and the chairman of the higher education subcommittee worked on these bills, and I'm very grateful that I think that the higher education community understands that we have to take certain actions this year that will be helpful and move this ball along. And so the substitute, I think, is not opposed by any of our colleges unless there's someone that I don't know right now. Having yet to say that all of them love your bill, Senator Servell, but they think that it is a way forward. So with that, is there a motion and a second to report the substitute?
Move to report.
Motion second that the substitute be reported. All those in favor say aye. Aye. Those no, the substitute reported. Very good. There's one no, I'm sorry. Senator Howard.
Senate Bill 1035 was Senator House's. She had requested for deputy school officers.
Okay, without objection, Senate Bill 1035 will be served next.
And Senate Bill 1036 was also Senator House. And the recommendation we got was for the Virginia Student Loan Refinancing Authority. And it was government, refinancing loan guarantee program. And the recommendation of the subcommittee was that we satisfy indefinitely with a letter shed 529 in the Department of Treasury received about how we need to get a deal with this.
Okay. So Senator Howard, I know you wrote on this book,
Yes, thank you, Mr. Chairman. Last year, you wrote a letter to those three organizations asking them to look at it, and it is really one of the best reports I ever saw on student loans. We took one of their recommendations and put it in the bill, but as we looked more at it, we really need them to flush it out for us. Because we really want to get it right. They're $30 billion in debt, student debt in Virginia. So we want it to be right, and I think it's going to take another year of that.
So Chairman Sasswell moves that the bill be TDI, but we send a letter that helps us bring this together. There's a second to that. All those in favor say aye.
Aye.
Opposed, no. That bill is passed by. Senator Sasswell.
On Senator House, Third Bill 1053, there was a recommended report for finance, and to vote
education or nonprofits, private institutions of higher education. Those terms are defined in 23.1-101.
So there's is there a motion on the amendment?
Second.
The motion is second that the amendment be agreed to. All those in favor say aye.
Aye.
Those no, amendment agreed to. So we're still on Senate Bill 1053. There's a motion and a second that 1053 be reported and referred to finance as amended. All those in favor say aye.
Aye.
No, bill is reported and referred to finance. Next up is Senate Bill 1121.
That's Senator Pikes. That deals with the independence of military personnel to manage with under service conditions, in-state tuition, the recommendation report and refer to finance failed to 2, so there is no recommendation.
So, okay, so the patron is asking to go restriction. So Senator Pike, thank you. I know you're going to continue to work on this. There's a motion second. Motion without objection. The bill will be stricken. Next is Senate Bill 1353. I think, well, go ahead.
This bill by Senator staff provides that the primary duty of any governing board of a public institution that is essentially what they are is essentially they'll be told what their primary duty is, and I think what they were getting at was you know, you have a responsibility to comment as opposed to just university. Okay.
So the recommendation was 3 to 0 to 1 to report.
301 to report that the primary obligation was not to the university, but to the Commonwealth. Quite frankly, if we look at law, I don't think any of them think, I don't think any of them are think that the primary obligation is not right. But anyways, that was the vote. I think I was
So there's a motion.
Mr. Chair, Senator Sasslaw speaking to his microphone. We're gonna have to let-
Oh, I can't hear a word being said. The bill that Senator staff put in was that the primary duty of the board of visitors is not to the university, but to the Commonwealth of Virginia. The vote on that was 3-0 to recommend that we report it.
And refer.
And we refer to finance.
So there's a motion and a second that the bill be reported.
Mr. Chair,
Sure. Yes.
why is that being referred to finance?
Senator Peterson, they have asked for this bill, and I have resisted some, as you know, and some I have not. I plan to be very supportive of this bill upstairs, and I hope that it will pass. There's a motion and a second that the bill be reported and referred to finance. All those in favor say aye.
Aye.
Those no.
No.
Report your noes. Very good. So the bill is reported and re-referred to finance. Next up is Senate Bill 1376, Senator Peterson bill.
And what we did with that was we, Senator served on a similar bill and has been enrolled into Senator Peterson's bill.
All right, without objection, Senate Bill 1405 will be rolled into Senate Bill 1376. Senator Sasslaw.
And that's, it's a notice bill that is going to increase tuition or mandatory fees, I think, for provide 30-day notice. That makes Senator Peterson.
Yes, sir, 30-day notice.
And it was recommended with the substitute to be handed out now.
Okay. There's a motion and a second that the substitute be agreed to. All those in favor say aye.
Aye.
Those no. The substitute be agreed to. Senator Peterson, can you put comment on that bill?
Excuse me?
Any comment on that bill?
No, I think it's pretty
Bill 848 from Senator Wexton. We recommend you report with a substitute. What this was dispensing of naloxone and how that would be done. And we heard a lot of testimony on why, on the positives of it, but there was zero criticism. So I would move that it be reported.
There's a substitute, I think it's.
Yeah, before there's a substitute be reported.
Perfect. So there's a motion that a substitute be agreed to, and this is for Senate Bill 848. Senator Wexton, all those in favor say aye.
Aye.
Those no. And the substitute reported. Now, Senator Sirlon, there is an amendment that Senator Wexton thinks helps to the substitute. Do you mind if we hear that real quickly? And then-
Sure.
Okay. So, Tom, why don't you report the substitute and see before we hear?
And Mr. Chair, on 421 and 422 of the substitute, strike all that new language for statewide standing order issued by the Commissioner of Health, where it says to me, that language was carried over from an old version of the bill that stayed in.
So that's a technical amendment, and all those in favor of the technical amendment will say aye. Aye. Those no, and technical amendment is agreed to. Senator Suderline.
Yes, Mr. Chairman, the next bill.
So if you could just have a motion maybe to report as amended.
Yes, so moved.
Motion is second that Senate Bill 848, Senator Wexton's bill, be reported as amended. All those in favor say aye. Aye. Those no, and the bill is reported as amended. Senator Suderline.
The next bill was Senate Bill 1232, from Senator Donovan. It also had a substitute.
Right, there's a motion and second that the substitute be agreed to Senate Bill 1232. All those in favor say aye. Those no, and substitute agreed to. Senator Suderline.
The bill prohibits for the prescription of controlled substances containing opioids for longer than 3 days supplies, and it also has a sunset that expires in 2020. There's a lot more.
The amendment actually changes that a little bit. It mandates that you have to check with DMP if you prescribe narcotics for acute pain for more than 7 days. The one exception to that would be for surgical pain, where they would have to check with DMP at 14 days if they prescribe it beyond that time.
So, Senator Donovan, thank you for working on that. I know that had a lot of work behind the scenes. And for those of you in the audience, I think we're moving quickly, and we are. These items are embedded in the subcommittee. This one, for instance, had enormous negotiation, and so it's not quite as easy as it's doing. So with that, there is a motion on the bill as amended in the substitute. And all those in favor of reporting Senate Bill 1332 as amended, say aye. Aye. Those no, and the bill is reported. Senator Suderline.
The next bill, Senate Bill 1244, also from our co-chair, Senator Donovan. This dealt with glucagon again. After some discussion, it was decided that this was best worked with the Commissioner of Health over the next year, and we unanimously recommend passing by indefinitely with a letter to the Commissioner of Health from yourself.
Section.
So there is a motion and second that we TDI Senate Bill 1244, Senator Donovan's bill, with a letter to the Commissioner. All those in favor say aye. Those no. And the bill is TDI with a letter. Senator Suderline.
Senate Bill 1321 from Senator Carrico. This is a bill that also has a substitute.
Okay. There's a substitute before us. Motion second, we adopt the substitute. All those in favor say aye. Those no. The substitute is agreed to. Senator Suderline.
The substitute, as you're looking at it, is significantly different than when it was introduced. What it deals with now is primarily the practice of telemedicine in such a way so that folks can still get eye-prescriptions, contact prescriptions through, well, essentially telemedicine when they're not physically present with the doctor, but there would be a doctor involved. We heard testimony from several of the stakeholders that were originally opposed to the bill, and they all unanimously endorsed it. and there were several original stakeholders in opposition, so that was some task. And at that point, we then recommended a report on 5 of them.
Okay, so, well, great job in working it out. I know no one's happy or everyone's a little happy, but well done. So there's a motion second that the substitute for Senate Bill 1321 be reported. All those in favor say aye.
Aye.
Those no. One no. Next up is Senator Sewer Line 1484.
Senate Bill 1484 came from Senator Hayner. This also has a substitute.
Okay. The motion is second that the substitute to 1484 be agreed to. All those in favor say aye. Aye. Those no. Substitute agreed.
This one was one in which there was not much policy difference, it was just about getting it right. And there was unanimity in support of the substitute.
Everyone understands substitute. There's a motion and a second that the bill 1484 with the substitute be reported. All those in favor say aye. Aye. Those no. Those support. Senator Sewer Line, consider done, but thank you for your support. Okay, if the committee is acceptable, we will now move to non-member bills, and we will start with Senator Wexton, who has 3 bills before us.
I believe that we already took care of 2 of those 3.
Let's take the ones up that we did not.
Those 848 and 828 have been disposed of.
1549.
These 1549.
Senator Wexton.
Thank you, Mr. Chairman. Senate Bill 1549 would bring Virginia into compliance with the recent decision of the United States Supreme Court in Holmes Health versus Hellerstedt. It was a 5-degree opinion of the court, which the court reaffirmed Planned Parenthood versus Casey and stated that those laws, whose purpose or effect are the purpose or effect of laws that place a substantial obstacle in the path of a woman seeking abortion before the seed is attained viability are constitutionally invalid. So this bill would do 3 things. First thing it would do is eliminate the unnecessary requirement of a 3rd opinion in 3rd trimester abortions. There would still be a requirement that the woman's physician, attending physician, plus another physician opine that the death or damage to the life or health of the mother would occur should pregnancy continue. It would eliminate the medically unnecessary ultrasound requirement, which as the committee is aware of, previous legislation we have offered provided evidence that it disproportionately impacts women of limited means or in rural areas and makes it especially unfair and burdensome to them. It would also eliminate the requirement that any facilities that provide 5 or more 1st trimester abortions be subject to the unduly burdensome governmental regulations, that is, that they be regulated as hospitals. Complications from abortion are rare and are rarely dangerous, and abortion is one of the safest medical procedures performed in the United States. Other medical procedures, including childbirth, colonoscopies, tonsillectomies, dental surgery, and many cosmetic procedures, far more dangerous to patients, yet they are not subject to the same strict regulatory scheme Virginia would impose on abortion providers. Women are already going through probably the most difficult decision of their lives, so they don't need us making it harder for them. There are some various entities in support, including ACOG, Business Sports and Bill.
So, Mr. Wexton, first off, thank you for your efficiency. You really covered a lot of traction in one bill, and we're grateful for the way you did that. Without objection, we're going to put a clock on this for 2 minutes, so if you could have your people very efficiently, we'll do the same for the other side, and we'd love to hear those that are in favor of the bill. So if we would start the clock as soon as that.
Mr. Chairman, I think they're just, I don't know that they need to be heard.
Okay.
Anybody in particular wishes to?
They can raise their hand and be seen that they are in support of the bill. Great. All those here in support?
Mr. Chairman,
Senator Happy.
I'm sorry, you said it was supported by ACOG and I don't know.
The American College of Obstetricians and Gynecologists. They're pleased to see us no longer interfering, they hope that you would no longer interfere in the application.
And I know there's been support actions on this as well. So, guys, thank you anyone here that is in opposition to Senate Bill 1549, or would just like to raise your hand if you're in opposition? Okay, let's do the 2-minute clock. We'll just kind of move through that. So, Senator Wexton, we'll just hear briefly from those that have a different opinion on this bill. Welcome, if you identify yourself.
Thank you, ADO, Virginia Senator, and the Baptist, and we just feel like this is, we're going to go back on issues that we feel like have not been jeopardy and harm to the situation, and we're not sure that the Supreme Court decision is as determinate with regards to the fact that ours is in violation. We appreciate where the state is on this, and we do understand the challenges that the Senate is in. Thank you.
Very good. Thank you very much. Very welcome.
Victoria Town, President of the Family Foundation. We oppose this bill. As you know, you gave the authority to the Board of Health to make these regulations. They've been met since the Supreme Court decision and have taken that into account. We don't believe that it's necessary legislation at this time.
Thank you. All right, so that completes it. Maybe you can just give us your name and who you're with that you're opposed to.
And Bill Ray, Virginia Catholic Conference, we vote as well.
We appreciate Kathy coming by and just on what it says she wants to be in opposition.
Louise Hart with Virginia Society for Human Life.
Please, thank you. Welcome back. So I understand that maybe you were a little confused about it. Maybe we'll just put the clock back on, let those that are in opposition go now. Is that okay with you guys? And so we'll put a 2-minute clock on Senator Waxman. Those that are in opposition can come up and share their opposition under that 2-minute time frame. So sorry about that.
I'm sorry, Mr. Chair, I am not in opposition. I was on the opposite side of the room and not able to make it over. I'm Dr. Walker Harris from the Virginia Department of Health, and just wanted to clearly state that the administration's position is in support of this bill. Thank you.
Thank you, Council Day. Anyone else that would like to speak in opposition to the bill? Okay. Senator Wexton, you want to sum up your bill?
Mr. Chairman, I think it's time that we comply with what the Supreme Court has decreed. I know that there has been some dispute about what will happen with the new appointee, but this is a 5-4 decision. It won't be changing.
So what we will do is, I understand there are maybe a few more supporters that would like to have some minutes, so we'll just put the clock back on that, and we'll let you speak. We'll make sure we're hearing even in limited time those that support that. Welcome.
Thank you for letting me speak. My name is Catherine Long. I'm a PhD prepared faculty member in nursing and at the University of Virginia, but I am speaking on expressing my own opinions here. I'm testifying in support of Whole Women's Health Act. I've been a nurse for 20 years, working in a variety of situations with in favor of women's health. I believe that medically unnecessary laws that curtail women's access to abortion primarily affect the most vulnerable women. And I'll point out to you that many women don't have full control of their reproductive health. Women experiencing violence, which is the population that I have the most experience with, are especially vulnerable. I think we all know about the terrible consequences of sexual assault on women, including the possibility of unintended pregnancy. But we also don't hear a lot about something called reproductive coercion, where a large number of women who are experiencing abuse are actually experiencing birth control sabotage and coercion to get pregnant. And we have a large body of research now documenting this as a fairly common form of violence among battered women. An analysis of data, for example, from the Pregnancy Risk Assessment Monitoring System, which is a large national data set, shows that women with unintended pregnancies are up to 4 times as likely to be abused than women with wanted pregnancies. I think a compassionate society will not make these vulnerable women jump through more medically unnecessary hoops to obtain safe, legal health care in the form of an abortion. So I ask you to please support Whole Women's Health Act. Women deserve access to all reproductive health services, including abortion.
Okay, we have about 30 seconds left. Anyone else like to come forward and take their support for the bill?
Good morning, I'm Rebecca Caldwell with the 34th and Fairfax. I ask you to support 1549. When I was just a teenager, I tried to go to a county health facility and get a prescription for birth control. And they said, oh, well, we're going to tell everybody
No.
Senator Cosgrove?
Yes.
Senator Lewis?
No.
Senator Donovan?
Yes.
Senator Chase?
Yes.
Senator Zerline?
Yes.
Senator Peake?
Yes.
Senator Newman? Eight, seven.
So the bill is PBI 87. Senator Wexton, thank you very much for coming and thank you for your presentation. Does that complete all of your bills for us?
It does.
Thank you for coming by today. Next up is Senator McPike, who has Senate Bill 1116.
Thank you, Mr. Chairman.
That bill was rolled in, is that right? And then we let that go live temporarily. Is that the bill?
That was the recommendation for that.
We'll just let that roll for just a little bit longer and we'll take a look at your version and Senator Stewart's version.
Okay.
Next up, Senator Serville, I think all of his bills have been dealt with by now. Senator Reeves, welcome. You have a couple bills before us. Welcome.
Thank you, Mr. Chairman. If we take up Senate Bill 1159 first.
Okay. Senate Bill 1159, Senator Reeves.
Members of the committee, Senate Bill 1159 provides that the career and technical education credential, when required for a high school graduation, adult education, or alternative education plan, may be satisfied with the successful completion of the Armed Forces Vocational Aptitude Battery Test. Currently, under the law, the successful completion of an industrial or industry certification, a state licensure exam, a national occupational competency assessment, or the Virginia Workplace Readiness Skill Assessment satisfies such credentials. So, if you look at the actual bill itself, Mr. Chairman, those tests are listed between lines 80 and I guess 84, 83. This just adds the ASVAB to it. And for those who've actually taken it, the ASVAB is a very rigorous test. It measures the development abilities and helps predict future academic and occupational success in the military. There's no cost to the ASVAB. There is a fee for workplace readiness skills assessments, allowing the ASVAB to count could potentially save funds or allow for relocation of those funds. Many students we have today are listening or taking the ASVAB to access military service and choosing service upon graduation. I believe is commendable and appreciated. And Mr. Chairman, that's pretty much the bill, and I can go into further details of your questions.
So there is a substitute to the bill, and most of it makes technical assessments.
I can explain it if you like.
Sorry about that. Either way, Mr. Chairman, I think there's some technical issues.
So if we could hand out the substitute for you to see it, Tom, if you could give us the name of that.
Thank you, Mr. Chair. The bill was introduced, I had the sections out of order, so I can fix that. As well as one of the sections have subsection B that was set out twice. Our system hadn't updated that subsection B, should have been set out.
Okay. So this bill not in two subcommittees. Any questions about the bill from people in the audience? Those that are here to speak in favor of the bill?
Association, we're in favor of the bill, provides another alternative for children, and so we hope you pass it.
Anyone here to speak in opposition to the bill have concerns about the bill? Okay, if not, there's a motion and a second that we adopt the substitute. All those in favor say aye. Aye. Those no, and the substitute to 1159 is agreed to. Is there a motion on the bill as amended? So Senator Cosgrove moves that the substitute be recorded. All those in favor say aye. Aye. Those no, and the bill is reported. Senator Reeves.
Thank you, Mr. Chairman. The next bill I have for the committee is Senate Bill 1160. Mr. Chairman and members of the body, this bill is probably trespassing a little bit, but I think it's a needed trespass. And what it does is the Advisory Board on Teacher Education Licensure is a pretty important board. And as many of you know that serve in this committee alone, we've had our challenges in the educational realm. What this bill would do would allow 2 members of the legislature to actually serve on that advisory board so we can get more feedback on where we need to go with teacher licensure and some of those things as we develop workforce development. So it specifically makes that adjustment. It's appointed, 1 delegate appointed by the Speaker of the House, and then the other one by the Senate Rules Committee. And this just is the exception or prohibition against service by legislative boards within the executive branch. This came at the request of one of my superintendents who was really focused on workforce development. How do we get it to those of us in the General Assembly so we have a better understanding? And I think the best way to do that is actually have members that are engaged in that as part of that process. And that's the bill, Mr. Chairman.
Are there those that are here to speak in favor of the bill? Are there those that are here to speak in opposition to the bill?
Mr. Chairman, there is a physical impact statement. The Department of Education can incur additional cost estimates including $4,400 and $5,800 per year to reimburse the two legislative members of the advisory board. That's fine.
Okay. Very good. So 1160, they looked over the bill. It's pretty good. I don't think they need it upstairs. So we'll, if the desire committee will decide that here. Okay. There's a motion and a second that Senate Bill 1160 be reported. All those in favor say aye. Aye. Those no. No report.
Okay, Mr. Chairman, the last bill I have is Senate Bill 1162, and I know Senator Sugarline has a bill that's very, very similar to it. And I know that there's a couple bills that have made it out of the House. They're headed this way with some amendments. I was looking to try to amend my bill close to one of the delegates' bills because they're all designed to do the same thing. And really what this is to allow those of us in the teaching field that do this day in and day out to get more teachers that are involved in not just teaching but the VOTEC side. And I have some facts, but there's demand in 2015 to 16 school year, 293,788 middle and high school students were enrolled in one or more CTE courses. I don't know how you all are in your districts, but our school districts are starving for teachers in those locations to teach. What this does simply is allow the authority for, in my bill, the division superintendent or the local school board to waive some requirements for prospective teachers in the school division, and it lists a gamut of them. I know there's a little opposition to the bill with regard to the time frame for credentialing. I spoke with Mr. Bailey about it. They would like to see 3 years from the time of employment for those additional credentials. If somebody comes in and say they're a really good welder, they've got 30 or 40 years of experience welding pipe. Part of the challenge why we keep them in there is this credentialing and the other, I don't want to call them regulatory burdens, but just the credentialing burdens that they have. But that's the bill, Mr. Chairman. And I don't know what you want to do, if you want to look at Senator Sugarline's bill.
I'd just like for Senator Sugarline to give us your version of the bill so we understand what the differences are.
My bill, which is Senate Bill 1583 on the docket, it permits the school boards or division superintendents to waive enumerated licensure requirements for seeking teacher initial licensure or renewal with endorsement in career technical education. And if you look at lines it is lines 53 through 75 in the PDF version. Those are the enumerated provisions that would no longer be required. A lot of these are things that I think we agree we want teachers to have in general, but this is for the career and technical education teachers where we often have difficulties getting the folks with the skill set in the schools to teach. And sometimes they might only teach a part-time provision. Often these folks are people from the trades that can make substantially more money in the private sector, want to continue doing that, but would also like to contribute to the community directly through the local schools. And that's why the bill is continuing.
Okay. So to sum up the differences for the committee's sake, Tom, why don't you give us kind of a sum up of the differences? And I think we only want to send one policy
speaking for the superintendents and school boards for this one. We're in support. We think that this type of flexibility is critical now with our teaching force.
Do you have a preference between the two versions?
I think whatever would do the most in terms of giving the most flexibility, would be one of those.
They just do it in a little different ways. Yes, those are also in support of our opposition. Well, okay.
Mr. Chairman, members of the committee, David Bailey on behalf of the Virginia Career and Technical Education Association. We have a handout, I don't expect you to read all of it, but let me point out that in talking with Senator Reeves, if you look at his bill, lines 78 and 79, and then the rest of that section, what his bill would seek to waive is a requirement that someone teaching in career and technical education would have an endorsement in the area and have an industry certification. It's clearly my understanding that teachers already have a 3-year window to get that. But if they didn't get it at all, then the students wouldn't be able to get the industry certifications that they need. And so I think in speaking to Senator Reed just before the committee was beginning, that having a 3-year window for someone teaching in the field to be able to get the industry certification is quite reasonable. But I think eliminating the need to have the industry credential does no real service to the students who would be receiving the education. So in all due respect to the superintendents and school boards, I don't think they would want to have students not able to get the credentials that they need, the certification that they need. And so we would oppose that portion of the bill. I don't believe that is in the bill that Senator Suderline has introduced, that it eliminates some other matters that would be of some concerns, but don't eliminate the real essential part of the industry certification.
Thank you very much for the explanation. I think that was helpful to the, are there others that are here just speaking in favor or in opposition? Welcome.
Mr. Chairman, members of the committee, good morning. My name is Jim Livingston. I'm president of the Virginia Education Association. I'm standing before you to speak in opposition to the bill. This is a Band-Aid. Yes, we have a shortage of CTE teachers. We have a shortage of math teachers. We have a shortage of science teachers, social studies, English. And our greatest shortage of classroom teachers in Commonwealth today is in elementary classrooms. We have 800 unfilled positions today reported by the Virginia Department of Education. We need to be working on a solution to a teacher shortage problem. And that's going to require more than a Band-Aid. With all due respect to the patrons bill, I understand there's some immediacy. But there's immediacy to these other unfilled positions as well.
Okay.
This General Assembly needs to address the teacher shortage crisis in the Commonwealth. We are opposed to the bill. Thank you.
I'm just curious whether he's speaking for or against.
Very good. So, Senator, there's obviously some support and opposition, but it may be that the Senator Suderline bill, version of the bill, is one that is more of a partway step. If you have any opposition to rolling your bill into Senator Suderline's bill, we can consider that.
Mr. Chairman, I'd be happy to make that motion. We want the roll line and
So,
illustrate the chief co-picture.
without objection, we're going to roll Senator Reeves' bill into Senator Suderline's bill for consideration. And with that, David, do you want to sum up on your bill?
Well, just like I said, with the, I can go through each of the requirements away, but essentially, the ones that we're not taking out completely, but for this specific opportunity, that's what we're doing. I would say, yes, there's lots of things we need to do, whole-scale education, like one of the previous speakers said, but this is, just because you have other medical issues doesn't mean you don't also need Band-Aids. And I think this is a good step forward that will help a lot of folks. And I also point out that the House is advancing very similar legislation to my bill that hopefully will advance today.
Okay. Anyone have a question, committee members, on the version that is in Senate Bill 1583?
Mr. Chair?
Yes, Senator Peterson.
Question for David. This is an option superintendent, correct?
Yeah, it's gonna allow the superintendent of school boards that authority to go ahead and waive some of the criticisms.
So they don't have to do it if they don't want to.
Correct.
Okay, Bailey, do you feel better about this version and stuff? Okay, is there any other questions to either of the two patrons? If not, is there a motion on the bill, and we will roll these together, vote chief co-patrons? There's a motion and a second that the bill be reported. All those in favor say aye. Aye. Opposed, no. The bill is reported. Senator Reeves, thank you for coming by today. So up next, is, I think we call Senator Steps bill. And then, Senator, Carrico, I think you had a substitute that we kind of technically got, maybe the wrong one on. You want to reconsider that?
Yes, Mr. Chairman, Senate Bill 1321, we adopted this substitute. I make a motion that we reconsider the vote in which we adopted this substitute.
This is the bill related to atomic systems. There's a motion and a second that the bill, that was before we read that vote, we reconsider. All those in favor say aye. Aye. Opposed, no. That bill is reconsidered. And then would you mind reconsidering the vote on which we adopted the substitute?
I move that we reconsider the vote in which we adopt the substitute to Senate Bill 1321.
Okay, motion second to reconsider the vote on which we adopted the substitute for 1321. All those in favor say aye. Aye. Opposed, no. The substitute is agreed to. Senator Carrico.
Mr. Chairman, in committee, we had several amendments to the substitute that we adopted, and now we have the proper substitute before you, which would have all the amendments that brought all the stakeholders together. This seems to be by, and I would move that we adopt the substitute that's before you, the purpose.
Any questions about what we're doing? There's a motion and a second that the substitute be agreed to. All those in favor say aye. Aye. Opposed, no. Substitute is agreed to, and there's a motion on the bill as amended. Move report. Motion and a second that the bill, Senate Bill 1321, be reported in form of substitute. All those in favor say aye. Aye. Opposed, no, and that is reported. Thank you, Senator Carrico. Okay, up next, do we have any other non-members except for Senator Pike, which we're still working our way through, that are here? If not, it might be helpful, given the fact that we are planning on dealing with all the bills on the agenda today, if possible, that maybe someone could contact Senator Cavola, Senator Wagner's bill we're going to send upstairs, and also Senator Edwards. So with that, what we will do now is we will start taking up member bills. First off, I'd like to, with the consideration from Senator Peake on Senate Bill 1570, he would like that bill to be rolled into Senator Donovan's 1240, both related to virtual Virginia.
Yes, Mr. Chairman, I do.
There's a motion and a second to roll 1570 into Senate Bill 1240. All those in favor say aye. Aye. Opposed, no. Next up is Senator Donovan. How do you address your 1240? What that provides for the day?
It provides temporarily. Mr. Chairman, could we make Senator Peake equal patron?
Yes, please. We'll do that. Do not make Senator Peake a co-patron on Senate object. Yes, we'll go by member. Okay. Are there other member bills that we would like to take up? speak, welcome. Wait just a second.
Thank you, Mr. Chairman. Jared Coffey with Virginia 21. Just really quickly wanted to lend our support to the bill. We think that it would ensure that our students are graduating on time with as little debt as possible. So we support this bill as well as Delegate Cox's bill. Thank you.
And I apologize, maybe I don't know too, but what is the Virginia Guarantee Assistance Program?
It's a program that I think currently exists, and this is a modification to it. It's assistance for, kids that need help, but they need to be full-time. And this allows a little more flexibility.
General fund dollars?
Senator Peterson.
I believe it is. General fund, the answer is yes. Pretty sure. If I find out differently, I'll tell you.
Senator Chase, question to the patron.
Mr. Chairman, Senator Sasko, how would this differ from the Virginia Student Assistance Authorities?
I don't know. We had this bill last year, if you remember, in the past, and because it was a fair difference between this and what the House had done, really worked out, but we're a lot further along this time than myself and Delegate Cox. This is an existing, this program is an existing program.
All right, why don't you come and share with us your thoughts about the bill? Welcome.
Former Chairman of the committee, and EADs will stay on for higher stations, either bill, questions, somebody otherwise.
You help us with Senator Peterson's question and Senator Chase's question, and then we'll plan to send us, if that's the will of the committee.
Absolutely, sir. Yes, these are general fund, Senator Peterson, Mr. Chairman, each year the General Assembly appropriates general funds to the institutions used for need-based financial aid. They will divide those funds up as a single appropriation that's then used for the Virginia Guarantee Assistance Program and also the Commonwealth Renewal Assistance. Single source appropriation is those are two different financial awards. The large general fund programs. I think that partially answers the other question about what's the differentiation between the Student Financial Assistance Program, the funding source, Guarantee Assistance Program, Commonwealth Award, or the latest awards to students.
One question. Maybe this is an obvious question, but the funds that are appropriated under this statute, they go to in-state students or all students?
In-state students.
Okay, Senator Donovan.
So, I just want to make sure I'm correct on this, but as I read this bill, it basically just makes criteria such that you can't get funding if you don't complete the coursework.
Yeah, you got to be moving, on a schedule and get you out in 4 years. And what it does, I mean, that's the purpose of this, is to encourage you to graduate in 4 years and not 5 or 6. So by having, 30 hours, it moves it along and it minimizes the debt.
So it's setting the appropriate incentives for us to actually get the outcome measures that we want as opposed to just paying for enrollment, and I think that's wonderful, and I'm in support of it.
Okay, this is helpful. Are there any other questions on the bill? Hearing none, is there a motion to report and refer to finance? There is. All those in favor of reporting and referring to finance, say aye. Aye. Those no. Bill is reported and referred to finance. What we're going to do is we have Senator Lucas's bill, and we get some of the non-members after that, Lola. Mr. Stewart, you've been working with Senator Hyde on the versions of y'all's bill. I think we need still just a little bit of massaging of the differences between them. Senator Lucas.
Thank you, Mr. Chairman. Senate Bill 975, please. And I have an amendment I'd like for Tom to please share that with the group.
Could you talk about
Yes, sir, Mr. Chair. Thank you, Senator Lucas. SB 975, on line 28, after regional jail shall strike, be required to provide pre-admission screening services to such inmates. One or more of the community service boards that serve the counties and cities that are participants through will be provided. And insert, review any existing memorandum of understanding between the community service board and any other community service boards that serve the regional jail to ensure that such memorandum sets forth the roles and responsibilities of each community service board in the pre-admission screening process, provides for communication and information sharing protocols between the community service boards, and provides for due consideration, including financial consideration, should there be disproportionate obligations on one of the community service boards.
All right, are there any questions about the amendment supported by council? Here none, there's a motion and a second that the bill be, that the amendment be agreed to. All those in favor say aye.
Aye.
Those no, and the amendment is agreed to.
Mr. Chairman, it's unfortunate that this bill became necessary as a result of 2 deaths in the regional jail. The one most spoken of has been the one of Jermichael Mitchell. And Mr. Chairman, members of the committee, what the bill does, passage of this bill as amended, requires community services boards associated with the regional jail to review their existing memorandum of understanding with the community services boards providing services in the county, city, where the regional jail is physically located. The memorandum of understanding shall outline the roles and responsibilities of each agency in the pre-admission screening process, communication protocols between the agencies, information sharing protocols, and shall reflect due consideration, including financial, should there be disproportionate obligations upon a particular community services board. And, Mr. Chairman, I have Dr. Schaefer, who assisted with writing the amendment here to the legislation.
Those that are here in favor of the bill, welcome.
Michael Schaefer, I'm Assistant Commissioner for Forensic Services of the Department of Behavioral Health and Developmental Services. The administration has yet to take a position on the bill, but we did work with Senator Lucas and all of his affected constituents on addressing some of the concerns that were raised by the bill as it was originally drafted. And we have been in a position that we seem to have good support across all the constituencies.
Okay. Are there any questions about the bill? Thank you for coming today. It's very nice. Anyone here in opposition to the bill? Hearing none, if we're going to do this, then we have to find a way to help fund it. So I think it does need to go upstairs to consider that if there's inclination to support the bill. There's no one else here to speak in favor or opposition to the bill. Is there a motion on the bill? Yes, Senator Cosgrove.
I move that we report the amended bill and that it be referred to the committee of finance. Second.
There's a motion and a second that Senate Bill 975 be reported as amended and referred to the committee of finance. All those in favor say aye. Aye. Those no, the bill is adopted. Thank you. Next up, I think Senator Bola, you are up next, and we'll have Senator Edwards, and we'll try to work through the Stewart bill. Senator Bola, welcome.
Thank you, Mr. Chairman. You know, Senator Edwards was waiting, but I will do Senate Bill 1504 first, if that's okay. It's a 3-line bill. It directs the Virginia Health Workforce Development Authority to work with schools of medicine and other schools of health professions to develop a curriculum in the field of geriatric health care. I did consult with Senator Barker, who I believe is chair of this Workforce Authority Board, and there's no fiscal impact. This issue came to me from the Virginia Network on Aging. They're concerned that we're not going to have enough professionals in the field who really do have some knowledge about geriatric care, and the number of folks aging is increasing.
Okay.
We're living longer.
Very good. Is there anyone here to speak in either favor or opposition to Senate Bill 1504? Senator Parker, you have any thoughts about this? Is something that you guys can accomplish?
Yeah, this is something we can do. We can work with the consultation with the schools and other entities. I am okay with it now, and we would
4 be reported. All those in favor say aye. Aye. Opposed, no, and the bill is reported. Senator Cavola.
Thank you, Mr. Chairman. The next bill is Senate Bill 1500, and what this does is it establishes a school health advisory board. This board is would be in the administrative branch of government. The only members on it would be experts. The governor would be able to appoint folks, the Senate Committee on Rules, and also the Speaker. The Secretary of Education and the Secretary of Health and Human Resources or their designees would serve on this committee. The purpose of the committee would be to evaluate what health issues are really appropriate for our school systems to take on. Apparently, we're getting more and more requests and pieces of legislation requiring schools to provide different levels or different kinds of services in the healthcare area, be it classes or other services. And the purpose of this is to really look at the whole picture and figure out what the appropriate role is for schools in maintaining the health of our young people. The committee would report to the governor and the General Assembly. I did not put in a fiscal impact statement. Folks I have been consulting with believe that this committee could be convened 4 times a year, not take a lot of resources, and could be done within the current envelope of resources. So I ask that the committee favorably consider the bill. I do want to add that many associations support it. The Virginia Athletic Trainers Association, the Virginia Association of School Nurses, the Virginia Association of Health, Physical Education, Recreation and Dance, Virginia Counselors Association, and American Diabetes Association. I do not know if there are people here to speak to the bill. I'm sorry.
So, is there anyone here to speak in favor of the bill?
Good morning, Bill Wise, representing the Arlington, Alexandria, and Falls Church School Boards. And we asked Senator Cavola to introduce this legislation because it's getting more and more complicated at the General Assembly level when we have so many issues about students' health and how they're going to be handled at the school level. And so we're not experts on it. You people aren't experts as far as, except a few of you, aren't experts as far as all of these serious health issues. And so we felt somebody needs to take a look at these from an unbiased and objective point of view and see what is it that schools can do as far as this is concerned. The other thing I wanted to point out to you is that Senator Miller had this bill in General Assembly in 2015, exactly the same bill you're seeing today. And his bill passed the Senate and got all the way to House Appropriations before being left in Appropriations. He felt very strongly about this bill, and so I'm hoping you will too. Thank you.
Thank you. Others that would like to speak in favor of the bill?
Good morning, Senator Newman and members of the committee. Becky Bowers, I'm here, and I represent the 4 associations aside from the American Diabetes Association that Senator Cavola mentioned. And we are very supportive of this bill. The time has come for a policy-making, policy deliberating arm to look at health issues and how they can best be dealt with in schools.
Thank you for coming by today. Are there those that would like to speak in opposition to the bill? Those that have concerns about the bill? Or anyone on the committee like to express thoughts about the Senator Donovan?
Yes, thank you, Mr. Chairman. I am very interested, obviously, in how we're going to deal with health issues that intersect with education, and we are going to have to deal with them. But I'm really concerned with the number of silos that we have currently in the administration and the way things are set up. And I think we're doing a lot of work this year to find a way to globally look at population health and solving some of these needs. And I would reluctantly speak against your bill, or absolutely speak against your bill, because I'm reluctant to set something up that's going to be one more piece of bureaucracy that will be something you'll have to be accountable and try to come up with a global solution. So I would move we pass this by indefinitely.
Motion seconded, the bill be passed by indefinitely. Any other thoughts?
Substitute motion.
Substitute motion, Mr. Howell.
Let it be reported.
Second.
All right, there's a motion and a second that the bill be reported. I'm a little on that. I'd like to know more, right? And so I feel like I'm not knowing more. Cat, pardon? So, we could have the bill go live for the day. Is that?
I'm happy to have the bill go by to the day and work with whoever you might think would.
Without objection, we'll go live for the day.
Okay, thank you.
And let me give you a reason, I apologize, this may not have been the right thing to say, but I think we need to get our handle around what we're asking teachers to do, right, and other professionals to do. I don't like the fact that there's no legislator really involved in this. I think rules needs to be involved in this. I don't think it's the right way, so I would have a no there. But how do you deal with the subject matter is a bigger issue, so.
I'm happy to work on it and then.
Sorry. So with that, Senator Edwards, you have one bill before us, which is 1111.
Mr. Chairman, members of the committee, this carves out one more good cause exception to school starting after Labor Day. It provides, as we have in Roanoke, a very robust dual enrollment program between the high schools and the community college. And the community colleges start in the middle of August and not after Labor Day. And this throws into confusion the calendar for everybody else. And so that's why they're going to have a carve out for those school systems that have a dual enrollment program and the community colleges start before Labor Day. The students therefore have to start before Labor Day, and it throws into confusion the school calendar. So they'll like to have an exception.
Senator, you are very creative. I got to give you that. This is a creative way. So we've heard this before. A version Senator Edwards is being more creative this time than normal, and so
That's more creative.
you're very creative always. The rest that are in favor of the bill, you in favor of the bill?
Can I make just one
Quickly, yeah, sure.
Mr. Chairman, Tom from the Superintendent Association, and I appreciate the ability to say something very quickly, because this is a little different in the past. We've got students from across the Commonwealth, probably thousands of students, within those school divisions that now have the waiver either grandfathered through the budget or there because of weather, that are utilizing dual enrollment. We are awarding associate's degrees through this process. It's a very popular process. But whether you believe in global warming or not, that we don't have as much negative weather, or it does change in the budget at times. If either one of those happens and these school divisions were to lose that waiver, there's no way to gain this exception. In the Department of Education, you can apply for a waiver as an exceptional program for a school, not for children. And so we would ask that you put this exception in place. Thank you.
We may be mistakenly, but it's okay. We started the clock. We're going to keep the clock on both sides of this. We've heard versions, but we get the differences now. If you'd like to speak in favor of the bill.
Yes, Mr. Chairman, Stacey Gaines, on behalf of the Virginia School Board Association, we're very much in support of this bill. This isn't the total refill, which lots of support, but this is much narrower, and we would ask that you support this bill to allow students to make it easier for students to participate in the enrollment.
Perfect. Thank you for coming by. All those who maybe, I know there's some in the audience that are in favor of it. If you want to raise your hand that you're in favor of the bill, thank you all for coming by today. And so with that, we'll start the clock for those that maybe have difficulty or opposition
Thank you, Mr. Chairman and members of the committee. My name is Brad Van Donlen. 10 months ago, I took over the position as president of the Virginia Beach Convention and Visitors Bureau. Prior to that, I spent 10 years in Michigan as the president of the Traverse City Convention and Visitors Bureau, where we had a significant amount of experience with the post-Labor Day issue. I just want to share some relevant facts from my experience in Michigan. Our bill took place in 2005. For the 5 years prior to 2005, before post-Labor Day schools, we had only 1% growth in hotel volume in the month of August. In the 5 years following 2005, after post-Labor Day school law took effect, we saw growth of 43%. 10 years following 2005, after post-Labor Day school, August volume grew by 121%.
We got a very short clock. I think you made a very eloquent position under it. There are others that are here to speak in opposition to the bill.
Mr. Chairman, members of the committee, Joe works with the Virginia Restaurant Lodging and Travel Association. We're opposed to the bill. We feel that this is a very specific issue, and we feel that this bill is not narrowly tailored enough to address that, and so we are in opposition to the bill.
Thanks, Tom. Welcome.
Chairman Jack Berry, Richmond Region Tourism, we're opposed to this bill as well.
Good morning, Mr. Chairman. Susan Gaston on behalf of Greater Williamsburg Chamber and Tourism Alliance. We also are opposed to the bill.
Thank you. Welcome.
Mr. Chairman, John Easter, Chamber RVA, we oppose the bill. I was also asked to say the Hampton Roads Chamber opposes the bill, but wasn't able to be here today.
Thanks.
Mr. Chairman, members of the committee, Kate Baker with the Virginia Retail Federation, and we oppose the bill as well.
Thanks. Anyone else speaking in opposition? 14 seconds.
Diana Burke with the Virginia Beach Hotel Association, also opposing the bill.
Perfect. Good. Okay. So, Senator Holman, you're in favor of the bill?
I'm at home, I am adamantly opposed to the bill as I have traditionally been, and you know, sometimes it takes collegiality for one jurisdiction or parochial area to help another area. And one of my concerns about this bill is I have to compliment Senator Edwards, who's masterfully drafted, because there is no definition or restriction on dual enrollment in every school district in the Commonwealth of Virginia under the latitude of the way it's drafted would fall within it. So I hope that you will exercise the collective wisdom that you've traditionally done.
Senator Holman, maybe you could help us a bit. In the last year, and embedded in this budget amendment that I think I put in that said that if you got an exemption before, then you continue to get that exemption. That has been going on now for almost 10 years. That is currently embedded in the budget again, is that correct?
Yes, sir. Yes, sir, it is.
So if we don't pass this amendment, that those school divisions that had the exemption will continue to have the exemption as they always have.
Yes, sir, it just showed your wisdom as a legislator by saying that.
That's the reason why I asked. I was going to say that your favor bill, after that.
Chairman, members of the committee, Roanoke City Schools in the city of Roanoke asked Senator Edwards to introduce this bill. We have a situation where the community colleges, of course, start for Labor Day, and we've got kids that are dual enrolled. So there's just a issue there. We're just trying to.
Well, you're a great representative. Am I correct that Roanoke County and Roanoke City both have to
Yes, they do.
today?
And we appreciate that very much.
Perfect. Okay, Senator Edwards, would you like to wrap up?
This bill is very narrowly tailored. It doesn't affect anybody but big schools that have dual enrollment programs in junior college. And I have not added it up. I have no idea how many there are.
You've heard the version of this bill many
And
times.
I would say it's not required. It's local option.
It's local. So, anyone on the committee would like to speak on the bill? Senator Superline?
I don't think it's reflected yet online, but I'm a co-patron as well. I think that, I don't agree with everyone at Senator Edwards' bill, but this is probably the best bill you have this year. And although we're fortunate to have a good conference committee right now that's working on the budget, that only lasts us for 2 years, and we have no idea what tomorrow will bring us. Roanoke County and Roanoke City, and the city of Salem, which I also represent in Roanoke Valley,
We often enjoy the waiver, but we don't always get the waiver. And there we have to rely on the presence of Senator Newman getting that amendment through finance. And it was really great to hear all the folks from the education consortium speaking against the, none of them did, I don't think. But I just think that it makes sense that those of us in the western part of the state that we care a lot about dual enrollment, we talk about career and technical education all the time. The community college has to start in August, and this would allow us to also reliably know this rather than hope every year that we get the budget amendment provision. So I hope that we'll support the bill, although I worry what will happen. I don't know if everyone will have the wisdom of Senator Edwards on this one.
Perfect. Senator Black. Thank you, Senator Sutherland.
Mr. Chairman, I'm in one of those odd districts that is not terribly impacted by tourism. However, I am very keenly aware of the fact that there are a number of districts throughout the state that really live or die on the income that comes in based on the timing of the school calendar. And for that reason, I have always supported those districts, and I encourage people to do likewise and to vote against this particular bill.
Thank you, Mr. Chair. I'll make a point. I've always supported this legislation. I will again. But this year, or actually the next school year, Fairfax County Public Schools is opening a week early because they qualified under the severe weather exception. So we'll actually have some data. That's the largest school district in the state by a multiple. We'll actually have some data at this point, so we can see if, what impact it had. I'm not disrespecting anybody's point of view. I have mine, but we'll know next year.
Okay, great. Anyone else? Go ahead. Senator Case.
Thank you, Mr. Chairman. I believe that we should give the tools to the localities and school boards who are elected by the people. I think that decision should be made at the locality level. And so for that reason, I support the bill.
Okay. Anyone else that feels the need to speak? If not, is there a motion on the bill?
Second.
There's a motion and second that the bill be reported. The clerk will call the roll.
Senator Sasslaw? Senator Lucas?
Aye.
Senator Howe? Aye. Senator Locke?
Aye.
Senator Barker?
No.
Senator Black?
No.
Senator Carrico?
No.
Senator Peterson?
Aye.
Senator Castro?
No.
Senator Lewis?
No.
Senator Donovan?
No.
Senator Chase?
Aye.
Senator Sutherland?
Emphatic yes.
Senator Pease?
Yes.
Senator Newman?
No.
7 yeas, 8 nays.
Okay. So the bill fails to report. We'll reverse the vote. That's okay with everyone here. And Senator Edwards, thank you for coming by and your thoughts about it. And creativity. We appreciate it. Okay, if I can have your attention, what we'll do is go back to our sheet. Can I, without objection, it's Senate Bill 1546, Senator Vogel's bill, go out today. There's a motion second to go out today. All those in favor say aye. Aye. Bill goes out today. Next up, we have a bill that needs to go to rehab. It is more properly there, and that's Senate Bill 1505. If I could bring your attention to Senate Bill 1505. If without objection, that bill will be re-referred to the Senate Committee on Rehab. Next up is Senator Wagner has a bill. I'm going to slow down just a bit to make sure you know what this is. This one is similar to the STEP bill, Senate Bill 1565, related to tuition increases. As everyone in the room will know that we basically had all those bills that went upstairs last week, and Finance says that they would like to get that bill upstairs. That's 1565. Is there a motion to re-refer that bill to Finance? There's a motion second that the bill be referred to Finance. All those in favor say aye. Those no, refer to Finance. Okay, next up, are there other committee amendments that you guys brought things up? All right, so Senator Stewart, let's hear from you, and Senator
help these children, get their catheters back in for their insulin pumps that they come out. And I think, Senator, Donovan may have suggestions to how we resolve it.
Okay, just to be clear, so we look back to this issue, a very important issue, we're grateful because both of you guys bringing it on. I think one of them has recommendations, is that right, on how we come up with the guidelines, and the other one had them getting the information. Sir, maybe clear that up for us, maybe the least regulatory way, not the exact.
I mean, we need to defer to the frequency, Mr. Chairman, on the specifics of the bills, but I think the take-home message is that there is some consensus on the idea that LPNs and RNs would be allowed with training to reinsert the catheters, and that the bill that Senator Stewart proposed would be rolled into Senator McPike's, and it would, be an article on designation so that we could send this out and have people look at it, much like Senator Favola agreed to a health issue that's in schools, to see how we can intersect those two worlds.
That's fine with me.
Very good. So let's have a vote to roll in Senator Stewart's bill, which is 1214, into Senator McPike's bill 1116. All those in favor say aye. Aye. Those no, they're rolled that way. Senator McPike, can you wrap up on that one?
Yes, Mr. Chairman, we also have an amendment, just for the good.
Tom, you have an amendment in addition to, or would you use it in the form of substitute?
Move the amendment.
Tom. So for those of you that are in the crowd, welcome. Do you understand what we've done in adopting the Senator McPike version?
Mr. Chairman?
Yes.
The amendment that Senator Donovan spoke to would be an enactment clause to Senator Stewart's bill, which would allow continued study. We have an amendment to my bill, which would provide the narrowing to LPN and RN designations. So we would have essentially two pathways, one of which would let licensed professionals to move forward. That causes no harm to Senator Stewart's bill as well. It would allow his to move forward with an enactment clause that the study group, as Senator Donovan said, that would work through this year for additional recommendations outside of those that have licensure status within schools. So it's sort of a two-pronged approach that I think would address both issues, as well as creating some relative peace in the valley on the issue.
I want to make sure we understand exactly what we're doing here. Can you help us out with the net effect of those legislation? Do you have more?
Yeah, just in the proposed enactment language that Tom has would not be necessarily appropriate to my bill.
Mr. Chairman, I don't think that amendment is appropriate. I think we got off track. I'm fine to have my bill rolled into Senator McPike's and have that bill go forward. And if we need to do more to it, maybe we can look at it between now and the floor.
We've already sold your bills into Senator McPike's bill, so the only question right now for the committee is, what does Senator McPike's bill look like?
Thank you, Mr. Chair. In the main, it would allow registered nurses and certified nurse aides to reinsert that silicone parts.
The catheters?
Yes, sir, thank you.
You would not require it, is that correct?
Yes, sir, would not require it.
It gives permission to do it, so we're not putting another requirement on top of them. We're saying that if this is the decision, then you have authorization to do it, is that correct?
Yes, sir, it would also require prescriber authorization and parental consent.
Does everyone understand that? Everyone in the audience understand that? Anyone in the audience still struggle with this approach?
Would the health department be allowed to prevent
Why don't you come forward and we'll hear your concerns and then we'll go with it. Welcome.
Thank you. Good morning. Thank you for letting me ask this quick question. My name is Molly Alonso. I live in Fairfax County. I'm a military family. I have 2 daughters with type 1 diabetes. We are now retired and living permanently here in Virginia. Fairfax County Health Department oversees the nursing support for our
Fairfax County, unlike most other school divisions, the nurses who are in the schools are not school employees. And so that's why this language on line 220 would not apply in Fairfax County. What I would suggest is that we address this.
Are there others here that want to speak? We'll do that in just a minute. We're coming up, and so if we're going to keep it fairly brief.
Okay, Mr. Barker, there is a substitute with that intent.
Why don't you look over substitute while we get more testimony and then share with us. All right. Yes, ma'am.
My name's Jenny Natividad, and it was at my request that the bills, have been working very, very hard on these bills with everyone that I can reach, at every level that I can reach. This is my daughter Annika, and it's on her behalf that we've done this work. So my question is that Senator Stewart's bill, I didn't understand the piece where that's going to be now a study instead of training for the staff and the nurses.
So we're going to roll those into Senator McPike's bill, and that's going to be the vehicle. So everything that is in Senator McPike's bill will be what we'll be moving forward with the substitute language.
Yes, as far as the health department employees, the substitute has line for the purposes of the subsection employee has the same meaning as in subsection E of 22-274. That section says employee includes any person employed by a local health department who is assigned to the public school pursuant to an agreement between the local health department and the school board.
You guys understand where we are now?
So that says they cannot be allowed by the health department, and then it's the health department.
Just make sure that the school division can do what they want to, but if it is up to the health department, this directs the health department to direction.
RNs, LPNs, and certified nurses aides, what is the language there?
A school board employee who is a registered nurse, LPN, or I wasn't sure if you, Senator McPike, were adding CNA or.
Guys, we're almost ready for this bill, I think, but I don't think we're totally ready. Guys, we're going to let it go by temporarily. Just take it back for the day, and we'll see if we can get all that. We want one policy coming out, so you guys decide if you want to take it by temporarily with people here or by for the day. You guys work that out, give us a signal, okay?
Okay, if we could, we have several folks that travel, so I think their testimony would still be relevant, even if we were to pass it by for the day, just in case folks, just for a brief second, we have a lot on the docket.
So Senator Pike, yeah, so we heard this in subcommittee, right? There's a couple of variable parts. Why don't we have everyone come up and state your name and support opposition, and then we'll get you guys to wrap this thing up, and we'll hopefully deal with this how we go today. So, welcome. Yes.
My name is Anna Natividad. I am a type 1 diabetic and asthma.
Thank you for being part of the genesis of that. Thank you. Yes.
My name is Bill McDad, resident of Stafford County, and I'm parent at the support bill.
Thank you for your help. Thank you for coming.
My name is Joanne Bill. This is my son Gavin, and we're from Prince William County, and we support the bill.
Welcome.
My name is Olivia Banks. I'm a resident of Fairfax County and the leader of a non-profit organization for type 1 diabetics. We support this bill. It's all for parents. This is my daughter Shelby, who is a type 1 diabetic and lives in insulin pump.
We support the bill. My name is Molly Alonso. I live in Fairfax County. I have 2 daughters with type 1 diabetes. A strong and traumatized program.
Thank you. It was very eloquently done. I think that, did you have something else? Yes, ma'am.
Good morning, this is Sandra. I am a diabetes educator, and I'm here with the Virginia Diabetes Council and AAD, and we are opposing the bill.
Okay. Even as a manager.
Just more communication and specifics and who specifically is going to be doing it with all the differences of insulin pumps that are available.
Okay. Senator Stewart, you don't mind working with Ryan. I think he can help us get to that end point, and so we can have them vote on it, all the people here.
I think it's happening right now.
Perfect. And we'll just let it go by temporarily. Okay, next up is other member bills.
Do you want me to?
Yeah, let me get your bill up, and you don't need to be involved in negotiations.
Thank you, Mr. Chairman. Mr. Chairman, I had Senate Bill 1246, which I would ask to go out for the day. We're working on that with the stakeholders.
about the Senate Bill 1247. And what that bill does is it would add Stafford County to the list of those counties that can have more stringent standards for private wells. Very simply, Mr. Chairman, the issue is Stafford County is one of those regions where it's, I guess it's more difficult to get to a water table that gives a sufficient amount of water for the well. So we're talking about water quantity, and that's why you've got a lot of reservoirs out in that area. The aquifer is incredibly deep there. I'm not even sure that you have it. And so it just becomes complicated. We've had situations, and I cannot tell you how many, where there have been brand new homes constructed, sold on wells, and the wells are dry. And somebody has to deal with it. Most often, the folks come to the county and say, I bought a house, the well is dry. The builder may be wrong on, you don't know what the situation is, but another well in that part of the world can cost $20,000 to $30,000, and the homeowners get stuck. And so they're seeking the authority to be in the list of those counties that can have stricter recommendations to make sure that those wells have sufficient quantity.
I want to understand this bill. I think we had Stafford and to city of Suffolk and the other counties. I would like to be in favor of the bill, be in favor of the bill.
Julia Carlin, on behalf of Stafford County. I echo comments of the senator as to why we brought it forward, but the hope is that we could alleviate this confusion going forward. We're not intending to do anything more than just ensure that there is water there in the home state.
Anyone else here to speak in favor or in opposition to the bill?
Mr. Chairman?
Yes.
Well, good morning, Mr. Chairman. I'm Mike Olson with the Home Builders Association of Virginia. I'm here to oppose Stafford County being added to this list of counties that seems to be becoming a Christmas tree type of bill. This does add significant upfront costs in the construction of new housing, upfront costs that are the largest impediment to home ownership in Virginia. I'm here representing the Fredericksburg Area Builders Association. They're aware of one incident where 2 or 3 wells had to be dug before they finally found water. Otherwise, there is no widespread experience with water shortage or water quality problems in Stafford County. We would urge you to reject this bill, and I would appreciate that very much. I'd be happy to answer questions.
Yes, Bo.
Mr. Chairman, Jeff Gregson on behalf of the Virginia Water Well Association. We very much oppose this bill. As Mike said, there really have only been at most 3 instances in the county, and what you have now is the county asking basically for carte blanche to regulate water wells all over the county, and we think that's a bit of a stretch. The way I understand some of the other localities that are included in this legislation, what they have done is identified a certain area of the county where there is a problem and got together with the builders and well drillers and worked it out for just those areas. If the county had come to the builders and come to the well drillers prior to the session and sat down, we might have been able to work something out, but that was not the case. So we had this bill, so I hope it would be. And one other thing, I think most of you are aware of the Eastern Virginia Groundwater Management Study. It's an ongoing 2-year study. It's going to conclude in the spring, and there's a goodly chunk, I believe, of Stafford County that's in that Eastern Virginia area. There are in all likelihood going to be some recommendations dealing with private water wells coming out of that study, so it might be ideal to kind of wait and see what they come up with before taking this step. So I hope it will be a pleasure to the committee not to report this bill.
Great. Thank you for coming by.
I'd just like to make some comments, and I don't know how many on this committee has had any experience of building homes. I've built 4, 2 in Northern Neck and 2 in Southwest Virginia. But I found, and all 4 have had wells. I found that the individuals now with the experience that they have in laying out the perk sites, the septic, and the well, the drilling the wells are pretty accurate in locating the aquifers are there and able to dig those wells. If you think you gotta go deep in the northern neck, come to Southwest Virginia, see how deep you gotta go there. But it's, to me, it's becoming very restrictive if we start doing this, when the lots are getting smaller sizes. And if you add Stafford County with the growing county that they are, I feel like we're getting pretty restricted there of how you can go all over those lots.
Okay.
Senator Stewart, I would just address that, Senator Carrico. I don't think they're restricting it. The idea is that they want the well drillers to adhere to standards that create the sufficient volume. There are very, very few private wells anymore in Stafford County. Most of the homes are on municipal water systems, but still some people do. Stafford they have a zoning that allows you to build a home by right on 3 acres. So if you've got 3 acres of land, you can do it. You don't have to go through any zoning or any restrictions at all. You just get a building permit for your house.
Let me clarify that real quick. I'm talking restricting, if my well right now is 7 gallons per minute, in order to have a reservoir to be able to supply to that house, I have to get deeper so that reservoir of those 7 gallons are sitting there that we need to be able to use. So basically, if you're going to say that the well drillers have got to have a certain amount, whether it be 3 gallons a minute, 7 gallons a minute, you're getting very restrictive on how they would be able to build that house. I'm not saying a lot, I'm just saying the depth.
The problem is, Mr. Chairman, the problem is if you build them under the current restrictions, gotta set restrictions. You call 2 or 3 well drillers and say, I want a well, and they give you a price according to the restrictions or the regulations. They're all going to bid based on the same regulations. They build it, and they're going to find out you don't have any volume. The well's not producing enough water to serve your home. So the only way, and I'm not even sure you can sue a driller because you did it pursuant to the restriction. That's the problem. They did it pursuant to the guidelines and regulations of the health department, whomever it is that stuff. So you're just flat stuck. You gotta go do a new well. You gotta go deeper. You have to have knowledge, and the way you learn from that is you spend $20,000 or $25,000 to find out you should ask for a deep well. That's why we're here.
Okay. Senator Chase.
Just a quick comment, if you don't mind. I actually have a similar situation, but we put in the contract that we had the ability to test for water and make sure that it was there before we bought the property ahead of time. So, I'm concerned that we're increasing the cost of business that's going to be passed on to the consumer.
All right, very good. Is there anyone else that has a question for Senator Stewart? Okay. So just so we understand, this bill, like it will be special legislation on the floor, it only requires a majority in this committee, so that's the way that this will go. Is there a motion on the bill? Is there a motion on the bill? Peterson, do you have a motion?
Yeah, I have a motion.
Well, at least you got a motion.
There's a motion and a second that the bill be PBI. All those in favor say aye. Aye. Opposed, no.
I got a unanimous motion.
Senator Stewart, we work for Senator, in fact, we're probably not going to have 3 strikes here, so you'll get it and be very succinct with it. We're going to go on to a couple of pieces of legislation, and then we're going to come right back to you. We're going to do it then. Okay? Perfect. Okay, next up, we have member of the bills. Let's go to Senator Donovan. Senator Donovan, do you mind taking on some of your bills? Senator Donovan, I think there's a desire to make sure that we go back to the day for some of the virtual school bills. So I think that would probably apply to all of the virtual school bills that are on the
I'm prepared to report today, Mr. Chairman, but if you have other interest in passing by through the
Okay. school bill with whatever agreement there is?
If I didn't know there was an agreement, but, I'm prepared to, if I have someone here from the Secretary of Education, there we go.
Great. So Senator Douglas, why don't you go?
Do you want me to start with virtual school? Okay, let's start with parental favorite, and we'll go to Senate Bill 1243, parental choice education savings accounts.
Okay.
So I won't go into an enormous amount of detail on this because we have seen this before, and in fact, this passed out of this committee in the body last year and was vetoed. And this is actually essentially the same bill that passed out of this body. If eligibility for these savings accounts would require 300% poverty level or an independent educational plan. And it is again 90% of the SOQ to the families. It is put in the name of the child. And so that, I'm happy to elaborate on that, but since I believe everybody knows about these bills, I think it's sufficient just to give those concerns.
Okay, guys, so let's have a motion on the substitute to 1243. Motion second, that substitute agreed to. All those in favor say aye. Those no, and substitute agreed to. Senator Donovan, if you have those that are here to speak in favor, I know we passed it from upstairs last year, but those that are here to speak in favor of the bill, and do you, or the other side, oppose the 2 minute clock? Are we okay on the 2 minute clock here?
I'm amenable to the 2 minute clock, yes, sir.
Very good. All right, those that are in favor of Senate Bill 1243.
J.C. Hernandez with Americans for Prosperity, and we support the.
Okay, are there others here that are here to speak in favor of Senator Donovan's bill? Okay, so let's stop clocking and we'll go to 2 minutes. So those that are here with concerns about the 1243, well,
We go reverse.
they had their shot.
They had their what?
They had their shot.
Oh, okay. Pat Lacey with the Virginia School Board Association. We've talked about this bill before, and I'm not going to trespass on your time. Let me say, first of all, that you will notice that this bill allows